Hello everyone and welcome back to my channel. Myself Dr. Surbhi Sahni. Hope you are doing great. Now today I come forward to talk about the another important topic of oral pathology that is very important for your NEET MDS preparation. So that topic is the talon's cusp. Definitely talon's cusp is known as the feet of an eagle, which is strong and definitely sharp. Now if we talk about the dense evaginatus of the anterior cusp, which is present, which extend from the lingual surface of the tooth, and it forms a three-pronged structure that appear as a eagle's talon, right? Developmental deep grooves are available when the cusp is about to meet, right, or fuse with each other along with the surface of the tooth. Hence, from half of the distance from the cemento-enamel junction to the incisal edge, composed of enamel, dentine and pulp tissue. If we talk about what are the teeth involved in the talon's cusp, usually the maxillary and mandibular incisors are involved. And if we talk about which incisor, whether the central incisor or the lateral incisor, more lateral incisors are involved than the central incisor. Now, if we talk about the reason behind it, so the first reason there, if we talk about the reason behind it, so the first reason there is the disturbances in the morpho-differentiation stage of the tooth development. Second, there is overall outgrowth of the inner enamel epithelial cells into the dental organ and transient epithelial hyperplasia of the dental papilla because of the compression of the tooth germ by the adjacent tooth. Outward growth of the inner enamel epithelial cells into the dental organs and transient focal hyperplasia of dental papilla, right? That result in the disturbances, that too caused by the compression of the tooth germ by the adjacent tooth. There are two syndromes associated with that. One is the Sturge-Weber syndrome, second is the Robinson-Tybee syndrome. So in case of Robinson-Tybee syndrome, there is the broad toes, broad thumbs, developmental retardation is there, broad toes, broad thumbs, and bone age is reduced by 50 percentile. On the other hand, in case of the second syndrome, that is the Sturge-Weber syndrome. In case of a Sturge-Weber syndrome, the clinical picture is shown on your screen. It is the rare neurological and the skin disorder which is characterized by glaucoma, and definitely there is the stains on the face, that is called the port wine stains on the face, followed by the hyperplastic lesions intraorally. The hyperplastic lesions are there, mental retardation is there, followed by the ipsilateral leptomeningeal angioma is present. If we see the clinical complications in this case, definitely the first is the caries, second aesthetic, and third one is the occlusal accommodation. Topic is the dense evaginatus, which is also has the other three names. One is the Lyong's premolar, second is the occlusal tuberculated premolar, third name is the evaginated odontome. If we talk about that, what is the dense evaginatus? It is dense evaginatus or the Lyong's premolar is defined as the accessory cusp or the globule of enamel which is present in the center of the tooth. Basically, it occurs mostly bilaterally, and that too present in the central groove of the tooth, whether in case of a molar or a premolar. It is resemble as a talon's cusp. Mostly the premolar and molars are involved, and the clinical complication is basically the pulp exposure or pulp infection followed by the occlusal trauma. Complication is the displacement of the teeth. Third complication is the incomplete eruption of the tooth. So that's all about the today's video regarding the oral pathology important topic. Definitely most important for the NEET MDS preparation. If you still have any query, you can drop me the mail which is shown on your screen, and don't forget to follow me on my Instagram ID which is shown on your screen. Till then, stay tuned, stay safe. Thank you for watching.